So from the patient's perspective, there really is no such thing as a minor surgical site infection. My name is Pierre Theodore. I'm a Vice President of Medical Affairs at Johnson & Johnson in our Global Public Health Group, and I also serve on the faculty as an adjunct professor of cardiac surgery at Stanford University. Surgical site infections can truly be life-altering. There are risks of additional morbidity and mortality and cosmetic issues that result from surgical site infections that can truly impact the quality of life for the patient. So several years ago, I required surgery myself. I had an injury while hiking in East Africa and ruptured a ligament in my left elbow and underwent what is known as the Tommy John procedure. And I suffered a clinically small wound infection. But from the patient's perspective, it felt like a major setback. 95% of patients not having surgical site infection certainly sounds great, but a 5% risk of surgical site infection still amounts to a large number of patients each year who suffer from surgical site infections. One of the real challenges around surgical site infections is there is no single profile for the patient that goes on to develop a surgical site infections. Often patients that are at very high risk end up having no problem at all. And sometimes patients with no discernible risk factor have quite a severe surgical site infection. It's important to remember that there is no magic bullet in the management of surgical site infections, and any effort to reduce the risk of complications should be embraced. One of the most important features for successful surgeries is a sense of confidence in the operating room and in the treatment of patients. And often that sense of confidence derives from a belief in the devices and the products that are used in the operating theater. Ethicon plus antibacterial sutures are an example of a strategy to reduce the risk of surgical site infections. It is a truism of surgery that bad things can happen to very good surgeons. And it's important that we separate the notion of the risk of surgical site infections and the skill set of the surgeon. I feel that the biggest misperception around surgical site infections relates to the notion that these are uncommon events or happen to other surgeons. While never fully attainable, perfection is always the goal in surgical care. And constantly driving as best we can to a 0% risk of surgical site infections is a goal in surgery. The responsibility for reducing the risk of surgical site infections is literally and figuratively in our hands. When it comes to surgical site infections, 1 is too many. 0 starts with 1.